All right. Good morning, everyone. Thanks for joining us today. My name is Katie Flores, and I will be moderating today. If you have any questions throughout the presentation, if you want to drop those in the chat, I'll be keeping an eye on that, and we'll be sure to have time for your questions and answers at the end. This is part of a three-part series we started last week. We're talking about tools for dealing with depression and anxiety today, and then next Thursday we'll cover grief and loss as a caregiver. So hopefully you can join us then as well. I am going to hand it over to Kimberly Knight. Kimberly is the Director of the Caregiver Support Program at the Senior Source.
Right. Thank you so much, Katie, and welcome everyone. As Katie said, my name is Kimberly Knight. I'm the Director of Caregiver Support at the Senior Source. And before we get started with today's presentation, I want to share with you a little bit of information about the Senior Source and the Caregiver Support Program. For some of you who are here today, this may be your first time hearing about the Senior Source or just kind of coming in contact with us. So I want to just share with you that the Senior Source is a nonprofit organization. We have been in the Dallas community serving for 60 years. And our mission is to enhance the quality of life for older adults. And we do this every day with all the programs and services that we offer. And we really work towards making older better. The Caregiver Support Program, Kate, if you go to the next slide, focuses on making older better by providing the following services to individuals 50 and older, as well as caregivers, because our whole main focus with the Caregiver Support Program is to provide assistance and support to caregivers. As you all know, caregiving can be a very overwhelming, stressful job, but it also can be rewarding. And so we're here to just provide information and resources for support and assistance. We also conduct care consultations with individuals and families. And a care consultation is simply when we talk to you one-on-one about exactly what's going on in your caregiving journey. We listen to you and from there just give advice and information and referrals for needed resources in the community and just try to help you navigate the waters that you're in and relieve a level of stress you may be experiencing. We also provide support groups for caregivers. Our support groups meet once a month, every third month, Tuesday, Wednesday, and Thursday of the month. And so we just had support group last night, 6 to 7:30. And that's just when caregivers come together. We provide a little bit of education, and then they get to just share what's going on in their world. And, caregiver support groups are something that people always kind of feel a little iffy about joining, but they can be a great resource to talk to other caregivers, other people who understand what you're going through, and also can provide you with information. Sometimes they are further along in their journey. They typically know doctors to go to or services to use, can kind of maybe help you avoid some of the pitfalls that they experience along the way. So support group can be a great resource as well as a great stress reliever. Then we offer caregiver education and seminars, much like what you're taking part in today. We provide education to the community on various topics to help educate caregivers. You can only make decisions from a place of knowledge. And so our goal is to provide knowledge on very chronic illnesses and just different things that are important to caregivers so that you can make informed decisions when the time comes. And then last but not least, we provide incontinence supplies. If you are a caregiver and your loved one is in need of incontinence supplies, you know how expensive they can be. So the Caregiver Support Program, we provide these things free of charge. And so if there's something you have need of, you can always call our organization and we will be happy to provide incontinence supplies for you. Next slide, please. This is just a slide that talks about a caregiver support group. We actually have 3. The 2 English language groups meet on the third Tuesday and the third Wednesday. They have 2 different times. We have one in the morning, one in the evening. And we have a Spanish language group that actually meets today, and they meet from 1 to 2:30 p.m. Next slide, please. And here are some of the other programs and services we offer. We have an Elder Financial Safety Center. They help individuals with utility assistance, older adults find employment. They also could provide you with information on Medicare and Medicaid. And even if you're considering retiring and you want to just talk about what some retirement planning could look like, we are here to assist with that. We also have a guardianship program. We have long-term care ombudsman program. And ombudsmen are individuals that go into long-term care communities and advocate on behalf of the person who's living there. So if you have a loved one who's maybe having an issue in a long-term care community, your ombudsman can help you with that. And so the ombudsmen are here, and we have an ombudsman program. And then if you're an older adult and you're wanting to volunteer, we have a couple of different volunteer programs. We have the RSVP program, foster grandparents who actually go into schools and work with kiddos. And then we have the senior companion program, who are companions to older adults, and just really go over and provide companionship and make a new friend. So these are all the services we provide at the Senior Source. We are here to help you. You can always give us a call at 214-823-5700, or you can email us at csp@theseniorsource.org for more information. Thank you so much. And I am going to turn it back over to Katie so we can get today's program started. Thank you all.
Thank you. Before we do get started, we just like to start our webinars with a few poll questions from our audience to kind of get an idea of how you heard about us and what your current situation is. So I'm going to pop a poll question up. First thing we want to know is, how did you hear about today's webinar? We market in several different ways, and we're just trying to determine the best way to reach out to you so that you can hear about us. So it looks like this is a typical response. We typically hear that a lot of people hear about us from the email blast or a Senior Source contact. So that's great to know. The next question we want to hear about is, what type of caregiver are you? Are you a family caregiver, a professional caregiver, or both? So we've got a mix, several family caregivers and some that are both family and professional. And lastly, we'd like to know your experience. Are you brand new at caregiving, or do you have some experience? So we've got brand new caregivers today. Great to know. Thank you. So like I said, if you have questions throughout today's presentation, feel free to drop those in the chat and we will get to those. And now I would like to introduce our speaker, Kimberly Pearson. Kimberly is the CEO and Clinical Director of Loving Yourself Well Counseling Agency. So I will hand it off to you, Kimberly.
Thank you. Thank you very much. I'm going to share my slide now. So are we able to see this pretty well? Okay.
Yep.
Well, welcome everybody to today's presentation. Today we're going to be discussing depression and anxiety for caregivers. I want to thank the Senior Source for providing this and even for inviting me out to do this. My name is, again, Kimberly Pearson. I'm CEO and Clinical Director of Loving Yourself Well Counseling Agency. I am also a doctoral candidate at Texas A&M Commerce, where my research is focused on faith-based counseling and community trauma. I often work with individuals who present with depression and anxiety. And so today I'm going to be offering a little bit of our clinical information and also about information that strategies that I use in private practice. So first, we're going to talk about the different types of depression, and then we're going to talk about the different types of anxiety. And last but not least, we will spend a great deal of our time discussing strategies to prevent depression and anxiety. So let's look at at depression. Again, I use this little image here at the top because in all of this, as a caregiver, first we must be reminded that when we are able to take care of ourselves, we have the space to take care of others. And sometimes when we are faced with some overwhelming uh, things that feels helpless and makes us feel hopeless, we may have experienced some moments of depression. So depression from a clinical standpoint is a mental health disorder characterized by persistent depressed moods or loss of interest in activity, causing significant impairment in daily life. I like to say depression is anger turned inward. It is when something is happening in your life or something has happened that you are really upset about. You're really angry about it. You don't like it. It's not what you would have chosen for yourself or for the moment. And unfortunately, you can't do anything about it. And then you get angry with yourself because you can't do anything about it. And that begins to feel helpless and you begin to feel hopeless. And that is how describe and explain depression for those that are not using a clinical definition. So there are actually 5 types of depression. And so the first one is major depressive disorder. And we would describe that when you have a sense of loss or a sense of lack of interest, and it lasts for at least 2 weeks. And this lack of interest actually interferes with your ability to work. You may have sleepless nights, or you may just sleep all the time. You can't study or you can't focus, and you may lose your appetite. I've even heard people overeating during this time, because they just don't feel like they can control anything that's happening to them, and it becomes debilitating. The second type of depression is persistent depressive disorder, also called dysthymia. This is when depression lasts for over or at least 2 years. And they may be a low grade depression where the depression becomes a normal. It becomes just a way of living where you just simply don't feel like doing anything. And it may not even be identified in layman's term, or when you're dealing with this, you may not even recognize that it is depression, because it has lasted so long and it's become the normal. Then there is prenatal depression, which happens after giving birth. And a lot of times we find that becoming a mom is overwhelming. It can feel like you are not living the life. It doesn't feel right. It doesn't mean that you don't love your child. It doesn't mean that you don't love your children. There's this overwhelming feeling of loss, of maybe I lost the life that I thought I should have, or I lost the opportunities that I thought I should have, or I'm not sure if I can be the mom that I want to be. And when that happens, it can interfere with your ability to function, and it can be debilitating. There's also seasonal affective disorder, and this comes with the seasons. Typically, it starts in late fall and early winter. Now, being a Texas girl, I'm one of those odd people that enjoy the heat. I don't mind the heat. I don't complain about the heat. First of all, I always know I can go inside and get cool. But what I am not comfortable with is that cold, brisky, cold air. and often when those seasons change and we now have to go in and hibernate, or the days get shorter, not much can be done, it can feel like you've lost something. It can feel like the time to get things done is shorter, and that can feel debilitating, which could affect your ability to function. And that was what we would call seasonal affective disorder. Then last but not least, there is depression with symptoms of psychosis, and that would be kind of like a comorbidity or co-occurring diagnosis where there may be hallucination or some type of delusion, or maybe some severe mental health issues that will also come, where depression will also be combined with that. You would also experience depressive symptoms. So here's some important facts for caregivers that I really wanted to share. First, it is estimated that 20% of family caregivers will suffer from some sense of depression. And this happens to be at least twice the rate of the general population. So caregivers are prone to have bouts of depression. There's also a recent study that found that 41% of former caregivers with a spouse who was experiencing Alzheimer's or any type of dementia symptoms, once that individual expires or transition, that the spouse that was the caregiver may experience depression 3 years after the spouse has died. And that's 41% of those may experience that. Last, women caregivers experience depression at a higher rate than men. And I don't, the study really didn't tell us why. I think I could just infer that women tend to be the caregivers more often than men. And even though we are the caregivers, our roles as moms, as daughters, as sometimes employees, it doesn't change. And that added responsibility, again, can really interfere with who we want to be and how we want to live our life. And that depression can feel overwhelming. So here's a few questions I pose to you. And this is kind of like your own little self-assessment. So consider these questions. 1, do you have a personal or family history of depression? Have you had major life changes? Have you experienced a traumatic event? Or do you have stressors that are extremely overwhelming? Have you experienced a physical illness that impact your quality of life? Have you felt persistent sadness, persistent anxiety, or even felt like you were empty inside? Do you feel hopeless? Have you felt shameful, guilty, worthless, and as I mentioned earlier, helpless? Have you lost interest in hobbies or activities you previously enjoyed? Do you find it difficult to concentrate, to remember things, or make decisions? Has it been difficult for you to sleep? Or do you wake up early in the morning or have, disruption in your sleeping patterns? Or are you just oversleeping and just do not feel like getting out of bed? Now, I want you to consider those. If you feel that some of these, your answer to any of those questions is yes, you may be experiencing one of those types of depression. So what do you need to know about depression? That, first of all, it's important to know that, not no two people are affected the same way by depression. So there's no one size fit all. There's no one size fit all for treatment. There's no one size fit all for diagnosis. And it may take some trial and error to figure out like what works for you. So when you are considering that, oh, well, I may be sad, but I don't know what to do about it. And, that's one reason why advice is not always helpful, because especially when you're going through, because there's no one size fit all to anything. And I often say to my clients, you are the expert in your life, and you are the one that will work with someone to figure out, well, what am I going through and how do I get out of it? Second, depression is one of the most common mental health issues or health concerns. A lot of people have depression, and it can happen at any point in life. What makes it more problematic with caregivers is that as a caregiver, you still have to take care of someone who is depending on you. And that would mean, you would feel depressed about being depressed, and you're in this loop or on this treadmill where you feel like you can't get off, and that will exacerbate those symptoms. Here's another one. Depression, especially in midlife or older adults, it can co-occur with serious medical issues. I often, when I read this and I think about this, I often think about these stress-related diseases that a lot of people have, like diabetes, like high blood pressure, and even heart disease. Those are stress-related diseases. And the more stress you are, the more inflammation you are creating in your body, and the more symptomatic you may be. And so when those things happen, depression will occur. It could occur. And so for those who are caring for someone who also have medical issues, they might also struggle with depression. The next one is medical conditions are often worsened. As I mentioned earlier, medical conditions are often worsened when depression is present. The research suggests that people who have depression and other medical issues, their symptoms tend to be more severe in both depression and in the medical issue. So a lot of times when we collaborate with our doctors, we would want to make sure that we're asking the questions like, how's the medication working? How are your medical concerns going? And how are you dealing with that? Because you won't be able, the research will tell us that you won't be able to fix one thing without fixing the other thing. So I have a client now that presents with a lot of medical issues, and I've had to say to her, we have to bring it down. We have to kind of get you to a point where you're functioning so that we can address the medical issues. Sometimes medication taken for the physical illness may even cause a side effect that contributes to depression. So, again, sometimes the way we may attack this is to look at the medication and see if it's the medication that's causing you to feel low and feel depressed. Remember what I said earlier. Depression is anger turned inward. So if we are finding ourselves in these dealing with some serious medical issues, and we all know how we respond to things. Sometimes we may be angry that we haven't taken care of ourselves. Sometimes we're angry about the fact that things have, again, happened in a way that didn't give us the opportunity to take care of ourselves. And that anger turned inward would lead to depression. And depression will create more comorbidity or co-occurring problems, so that the actual medical issue now is exacerbating the depression or even The depression is exacerbating the medical issues. So again, we want to make sure we take care of the depression first. So everyone has felt some sense of uneasiness. Everybody gets stressed, and everybody experiences sadness at some point in their life. However, when there is a clinical diagnosis of depression, it's more than just a feeling of sadness or feeling down or just feeling like you don't want to do things. It can become a very serious issue. And because if it, again, as I said earlier, if it starts to persist for more than 2 weeks, if you find that it is impeding your ability to work, impeding your ability to function, then it may require treatment, or it does require treatment. So if you've been experiencing any of those signs that we talked about, and you've experienced them most of the day, for nearly every day, for nearly at least 2 weeks, you may be experiencing severe depression disorder. So now we'll talk about anxiety. I know I whenever I do these slides, I'm always conscious about giving all the bad news first. So I'm gonna give the bad news first, and then we're gonna give you the good news last, so we can leave on a good note. So let's talk about anxiety. Anxiety is a strong feeling of worry, and it can cause nervousness, it can cause fear, apprehension, and even more worry. It worsens, it worsens as we get older, and it can worsen again the physical health because it leads to depression. It also decreases your ability to function, and it affects your overall well-being. Anxiety is a very debilitating problem. Worrying and feeling afraid that the things life is not going to provide you a safe place to navigate, whether it's physically or mentally, that can be very overwhelming. Here's where my layman's term of anxiety is and how I explain it from a non-clinical standpoint. Anxiety is about fear, and fear is about control. So when I say this, I'm saying the worry that things are going to go wrong, the three fears: the fear that something will reoccur, the fear of rejection, or the fear of something bad happening again. That fear can be very debilitating, and it causes you to worry. So what we do is we try to control the fear. We want to control the fear. And sometimes we try to control the fear with our worry. It's like, if I can think it through hard enough, if I can figure it out, and I'm worried about how I'm figuring it out, I can probably get it past it. But unfortunately, it doesn't work like that. The idea of anxiety and getting past anxiety really kind of boils down to letting go of control, because anxiety feeds depression. That's why those two terms tend to travel together, depression and anxiety, because anxiety feeds depression. So there are actually different types of anxiety as well. There is general anxiety disorder, which is characterized by chronic anxiety, worry, exaggerated worry, and tension, even when there is little or nothing to provoke it. I can only imagine. I mentioned in the session last week that I am in a sandwich stage of life where I have aging parents and I also have a teenager, and so sometimes I am caught between the two worlds, and it gets overwhelming. And there are moments that I worry. how am I going to balance it all? How am I going to take care of, be available for my parents while also making sure my son's okay? There are days when I actually do have multiple things to juggle. And the worry of getting it all done can really be overwhelming. And in my effort to handle my fear of dropping one of those balls, I may just say, I'm not doing anything. I can't even, the idea of trying to make it work is overwhelming. So I'm just not going to do anything. That would be, as I mentioned, anxiety feeding depression. And little do I know that I may only need to drive one place and use an Uber for another person, or I can come up with ways to get things done where it doesn't have to be exaggerated worry. The other one is obsessive compulsive disorder. Now, I don't think a lot of people consider this as a anxiety, a part of the family of anxiety, but it is, because again, when someone is being compulsive about something or obsessing over something, that is them trying to control whatever they think is going to happen. So I've seen on different documentaries about people that have to flick the light 5 times or do something multiple times. And the reason they're doing it is because they're thinking something is going to happen. So that is definitely a anxiety provoking trait. Next, there's the panic disorder. We will see that when people have panic attacks, and this definitely shows up as a physical symptom because there may be heart palpitation, sweaty hands. Sometimes people even feel like they're going to faint or pass out. And this is characterized by unexpected or repeated episode of intense fear. So the interesting thing about panic disorder is the fear of something else happening again. So it can occur because they may have experienced a episode where they passed out, or they may have experienced a traumatic experience, and the fear of that happening again will cause intense worry. And that worry becomes more physical than it does become mental. And so you'll see them, having to catch their breath, or we've ever even heard of people going to the hospital because they thought they were having a heart attack. And the doctor said, well, no, the EKG is fine. Looks like you were having a panic attack. So that actually also belongs to the family of anxiety. There's also post-traumatic stress disorder, which sometimes is a standalone diagnosis, but typically anxiety will also travel with PTSD. PTSD will trigger anxiety and depression. So the fear, that's the whole point of this. Anxiety is about fear. And when there is a traumatic event that has occurred after the event, meaning after the event, there will be some responses to it, even a feeling of stress about, the event happening. There may be some nightmares or flashbacks. I often refer this to person who may have had a car accident, and when they try to drive again, it's really hard. They're jumpy, they're easily startled, and it's real difficult for them to drive because the fear that something else that the same thing will happen again is debilitating. And they're going to try, the mind automatically tries to control the fear and with worry, which, because they can't do anything about it, because it's more of a physical response than it is a mental response, they can't do anything about it. They get angry with themselves for not being able to do anything about it. And that anger turns inward, which becomes depression. So that's how all that comes together. The last one is social phobia. That is, again, fear characterized by overwhelming anxiety, overwhelming worry, and excessive self-consciousness. And this happens in everyday situations. So, caregivers may feel, especially if it may be a young person, they may feel like, wow, everybody sees me out having to help my grandfather, my grandmother, or even my mom and dad, and they themselves may feel feel embarrassed or feel self-conscious about it. And because that fear of being seen in a way that they don't think that they should be seen is overwhelming, they can become very self-conscious and anxious about it. So here's a few things to know about anxiety. That 3 to 14% of older adults meet this diagnosis. And that's pretty high. That's pretty significant. That 14% of older adults may have some type of anxiety, overwhelming, excessive worry that they are dealing with. And I can only imagine when a person is dealing with a health issue and none of us know what's going on inside of our body. All we get is the word that the doctor is telling us, and we're going to take the medicine that they're giving us, that we may not know all the answers. We may not be able to control everything that is going on with us. And we may not even be able to control what's going on with our loved ones and the ones that we're caring for. And that could make us feel overwhelmed, and we would worry about it and even have fear about it. A greater percent of older adults have clinical significant symptoms, and it impacts their ability to function. So this really is important because, as I mentioned earlier, these stress-related diseases are exacerbated by these symptoms. So if I am feeling extremely anxious about a situation, or something that I'm going through with my parents or in my life, if I'm feeling extremely anxious and I'm trying to control it, I'm going to be very tense, very, very tense. My body is going to be tense. I'm going to feel it physically. And this will absolutely have an effect on my ability to function. And it can make whatever healthcare symptoms I'm having, it can make it worse. I see there's a question that looked like it came up. Do you mind if we hear that question? Or would you like to wait till we end?
We can do that. What do you consider to be the age range of, quote, older adults, unquote?
Interestingly enough, I did a class in my last semester of my PhD program, and they call it the third stage of life. And I was surprised to understand that I'm actually in the third stage of life. It starts at 53. Which is odd to me because I don't feel that. But older adults, they actually start that age at 55, believe it or not. And I can only, I'm sure a young person would say that's about right. But now that I'm 56, I don't feel right. But age, it typically is looked at 55 and older. And I think that's correct because that's when they will say, your senior citizen benefits kick in at 55. Mm-hmm. So yeah, 55.
Okay, great.
Mm-hmm. The most common anxiety disorder includes specific phobias and general anxiety disorder. So general anxiety disorder is really common. It's the most common anxiety. Not everybody is going to experience social phobia. Those are very specific disorders that will show up because of other reasons than caregiving or than any life transition issue. So the social phobia, obsessive compulsive disorder, panic disorder, and even post-traumatic stress disorder are less common in older adults, but they can present in older adults. Like depression, anxiety disorder are often unrecognized and untreated in older adults. And the reason that is, sometimes older adults again, have that dysthymia, low grade depression, and they've experienced it for such a long time that they themselves don't know it, and they don't know to talk to the doctor about it. I know now, most doctors will ask, are you feeling, how are you handling life? They'll ask, are you depressed, or do you have things that they ask more social questions, psychosocial questions, to try to get that recognized, or to diagnose that. But because the medical issues are typically the most acute issues that a doctor or a medical professional would focus on, they are not always likely to focus on depression. And that's the reason why it goes unrecognized and untreated for older adults. The detection and diagnosis of anxiety disorder in life is complicated, as I mentioned, by the medical comorbidity and even the cognitive decline, and the change in life circumstances. As I just said, my mom, she said to me once, she said, you got to be strong to get old, because it gets really complicated and it gets really hard to deal with the medical issues, the decline in the body and the decline in the cognitive abilities. Life changes a lot, and it can change real quickly. One fall and everything is different. So a lot of times the detection of even anxiety and disorder, it gets real complicated, because most of the time they're going to focus on the physical stuff and not the mental stuff. So again, self-assessment, let's just ask ourselves a few questions. Are you able to manage your responsibilities without worrying? Now, of course, we all gonna have some worry. It comes with life. But when it becomes exaggerated, are you still able to manage your responsibilities? Do you have any medical tests that you aren't prepared for? Remember my statement, anxiety is about fear and fear is about control. I believe even a false sense of control can help you cope with changes in life. You may not necessarily be able to fix something, but even if you gave yourself an opportunity to try, and even if it gives you a false sense of control, as a therapist, I'm okay with that. If it's going to give you peace, then I'm for it. Do you feel like you don't have control over your own life? And I know as caregivers, most of the time that's how caregivers will feel, that they do not have control over their own life. And that lack of control and the fears that are associated with that control will create anxiety, will create excessive worry. And when you believe that you are helpless and you're hopeless in that moment, then you will turn that inward, and that will be depression. Are you concerned about your loved one's well-being? Sometimes, the end of life process is really, really difficult. One thing, as I walked through that with my grandparents, my grandmother, who passed away at the age of 99, and when she expired, she was actually planning a trip to travel. So she lived her life to the end. But my grandfather, he suffered with dementia, and his last 2 years really took the whole family coming together and working with and supporting each other as he expired. And one thing I realized in that moment, and we'll talk about this more in the grief workshop, is those last years are the years that the caregivers have those last opportunities to show love, those last opportunities to express complete love and gratitude for all that the person that they're caring for has done. And when you are concerned about how they're living those last years, it can be overwhelming, because sometimes they are in pain. Sometimes, all of the medical things that they have to go through and some of the medical decisions that a caregiver have to make can feel overwhelming. So it's important to have someone to talk to about the concerns that you may be having about the loved one's well-being. Are you certain about your future? Are you certain about the future? If I as a therapist, I'm always going to turn my clients focus on future living, on things they can do, opportunities that are in front of them, and less on kind of processing what has happened, what should have happened. I have a statement that I coined that says, I can only do what I can do with the information I have at the time that I have it. That's as good as it gets. Now that gets me away from those feelings of anxiety so that I don't live there. I don't live in the worry. I don't live in the shoulda, woulda, couldas. And if I could, I can only use the information I have at the time that I have when I have it. And therefore, being able to see the future and move toward the future, even when the future may present with some great changes, that is kind of how we are managing, how we have to manage. Next is, do you worry about your loved one's diagnosis or treatment? Again, their well-being. And do you have enough support from your family, friends, healthcare team, or other people in your life? Last week we talked about support, and we talked about how burnout will really be difficult, or really can impact a caregiver's life. And getting support is key to avoiding burnout. So let's get to the good stuff. Strategies to minimize depression and anxiety. Now, what I am going to talk about here is different modalities or different treatments that I actually use in private practice. I'm sure if you go online, you may see other treatment. As I mentioned earlier, these are not one size fit all. These are cognitive shifts that one might want to explore as a way to cope with what they're living through so that they can avoid depression and anxiety. So first, let's talk about the internal conflict that one may have when they are experiencing depression and anxiety. There is a conversation that you may be having internally when you're beginning to experience this. And that conversation is a conversation between fight, flight, and freeze. And I love this image here, because fight will say, I really want to do this. I can do this. I need to do this. And flight is like, let's just leave because I don't want to do this. This is just not something I want to be doing right now. And freeze is saying, I don't know what I can do. I can't do it. This is too much. I cannot do it. Flight may trigger and a response that may look aggressive, may look like you may even have unregulated behaviors. Like, I want to do it. I need to do it. I can't do it. Now I'm like mad that I can't do it. So that may look confusing to others. Flight may look like disengaging behavior. So you not wanting to do it may often lead to extreme isolation, where again, that I want to sleep all day. I don't want to come out. I don't want to engage with other people. And because you're a caregiver, you have to engage with people. You have to do certain things. And for other people, that may look a little chaotic. That may look like, dysregulated again. Then freeze is a paralyzing behavior. And in that moment, there may be poor decision making, where you're not able to decide one or the other, or you just may be paralyzed in making the decision. Internally, that feels frustrating, that feels irritating, and it also causes anxiety. And it leaves you feeling bad about feeling bad, which again, that feeling bad about feeling bad is what causes you to turn those feelings inward, and that produces depressive anxiety. So there are 4 strategies that I'm going to quickly go through that I use in private practice when I am working with clients that come and present with depression. Usually, things that happen to us are happening in the context of our relationships, whether it's the context of someone who we're caring for, the relationship of the person we're caring for, or even the relationship of people who are there to support us. So first, we want to level set. What are we expecting from these relationships? Then second, I want to build a comprehensive relationship around me. I want to make sure that the people I have around me are really there supporting what I have to do, so I don't feel overwhelmed, so I don't get worried about dropping the ball. Then third, I want to deal with myself, because in those moments when I am overwhelmed, I can start to feel a sense of shame because I'm not getting it done, or, I have people that expect more from me than what I can do. And in that moment, I feel like I am less than who I think I should be. So I may feel shame and also guilty because you can't. I say shame and guilt always travel together. If you're feeling the shame, you're going to have some guilt. So we look at how we are accepting ourselves. And then fourth, we look at how we're going to accept others. So in step 1, I level set with what I am believing about the situation that I'm dealing with. If I believe that I can do it, if I have self-efficacy, I'm probably going to think that I can do it, and therefore I'm going to put all my effort into doing it. Second, I have to understand that every situation is fallible. Every situation, there is just not a lot of perfect situations that we're going to go into. Caregiving is not a perfect situation. There's going to be moments when you do drop the ball. There's going to be moments when people will disappoint you. So level setting myself to lower my expectations in those really difficult moments and allowing life to kind of take its course. Then I need to align my thoughts with self-helping beliefs. I need to feed myself with good thoughts so that I can avoid negative consequences. So as I said in step 2, we need to build a comprehensive support system. So I say, in the way I look at a comprehensive support system, as you being the center of that support system, everything evolves around you. And then you focus your attention, you prioritize relationships in 5 domains. First, I say God, but anything that's bigger than you, because we as human beings are very limited to our human experience. There's something we need to attach ourselves to that's bigger than us, so that we can have context and make meaning out of this space of the unknown. Second, a social life. Everybody needs something that they're doing that nobody is asking them to do something in. For me, my son plays basketball. I love just going watching basketball. I scream like I'm on the team. And then when I leave, nobody cares. I don't have to show up for anybody there. Then you need a counselor or a pastor or even a support group or an advisor, someone who's not involved and someone who's not invested in your process, but they can be a voice for you. They can be a presence for you. They can even work with you so you can hear yourself think. Then there's a family member. And of course, every family member is not going to show up. Every family member is not going to be your go-to. But if you can build a relationship with at least 1 or 2 family members that that they have signed up to support you, they understand what you're going through, and they're willing to do whatever they need to do to support you. That is what you need. And a friend. A friend is going to be by your side. They're going to be ones that you can laugh loud. You can talk about everything. You can vent to, and they will be able to give you a respite, give you a moment of where you actually can feel normal again. So this is how this works. I ask my clients, how are they how are they managing this comprehensive support system? Do you participate? And if you're not, then that would be the area that I think that you would focus on. Do you work within, or do you have a social life? Is there something that you're doing that you don't really cost you anything? We go through these steps and we kind of figure out what point of these is suffering, and what point can I pour my energy to, can I focus it, that will actually give me a sense of control, because not doing anything is really going to exacerbate the problem. Then step 3, I talk about developing unconditional acceptance of self. And to do that, there are 5 ways that you will develop unconditional acceptance of self. First, learn to be flexible with yourself. Let go of any feelings of guilt and shame, because it doesn't work well. It's not a good place to live. If you did it, as I said earlier, you can only use the information you have at the time that you have it to make whatever decision that you need to make. And that's really as good as it gets. You don't have much else to give in those spaces, and you do your best. And so being flexible with you actually gives you rest and gives you the moment where to be flawed. Embrace the idea that you're fallible. Embrace the idea that you're flawed. Embrace the idea that I saw that a lot of you, most of you, all of you are first-time caregivers. Embrace the idea that this is your first time doing this, that you may not have all the answers, and that there may be moments when you do drop the ball. It's okay. Resolve that internal conflict. I work with clients and with depression to resolve the internal conflict by listening to all the voices, figuring out if I need to fight, what type of fight can I do in this moment? What do I need to do to give me a sense of control? Sometimes it's really small. Sometimes it's simply getting up, making the bed. I at least can control what's going on in my room. Sometimes it's that, and that would at least get you moving forward and thinking forward. The other, once you have resolve the idea of your flight, you may say, I'm going to disengage at this point. When it gets so difficult, I need to bring some help in. I can only take it to this step. And this is as far as I know I'm willing and capable of doing. Then I'm going to turn it over to someone else. If you're working your comprehensive support system, guess what? This part is really easy. Then the last one, paralyze. Paralyze is going to be there whether you want it to or not. We will feel a bit of a apprehension in all situations that are unfamiliar. So we resolve all these things so that we don't get in this loop of trying to control something that we cannot control. And I said earlier, let go of the guilt and shame. It doesn't serve you. It's only there to hinder you, and you're doing the best you can. And you resolve it. And doing so, you resolve the fear. Last but not least is developing unconditional acceptance of others. Now, here's my 4 steps in doing that. Increase your level of tolerance. Again, know that we're all doing the best we can. Everybody in the world is really trying hard to live. And as we see across the board, most of us are struggling. Everybody is trying to figure it out. And if we can be a little bit more tolerant of others, we will actually not have to worry about how we would respond to others. Remember, you have to be good to yourself before you can be good to others. So that being flexible with yourself will increase your ability to be tolerant with others. Accepting everybody else's faults. When you're able to accept your own faults, then it's easy for you to accept everybody else's fault. But this is important. Establish appropriate boundaries. Make sure that when you are in a situation or you're dealing with relationships that are really more than you can handle, you create the boundary. You have to know what you can do and what you can't do. And then you explain that to those that are involved. And you hold them accountable to the boundary that you set. When you start shifting those boundaries or negotiating those boundaries, you are going to put yourself at risk. So having those appropriate boundaries is really important. And then last but not least, learn to reframe your thoughts. Learn to come up with different ways to perceive or to think about your situation, so that you're not letting negative thoughts influence how you live and how you think. So I'm gonna do these quickly because we're running up to our time. And this is also in our slide, in the slides that in the handout that I've provided. I use rational emotive behavior therapy to build rational thoughts, to create a reframe. And rational emotive behavior therapy has a concept that says an activating experience will have a belief system that create consequences that are either helping or self-helping or self-defeating, or it's either helping or defeating. The consequences is going to tell me if I am okay or not. If I begin to feel sad, if I am feeling depressed, then whatever it is I believe about that situation, it's not helping me. So then I need to dispute that. I need to figure out, well, what else can I think? What else can I believe about this situation? So I can reframe it. And I can find ways through reading, through prayer, through conversations, that I can reframe that situation so that I can dispute whatever irrational thoughts that I have. And once I am able to dispute it effectively, I then will create an effective belief, an effective way to think that's going to create self-helping consequences. So I'm gonna not go through all of that. I'm just gonna go through this one here that gives you, again, the handout that I have. So when you get this handout, there's 5 steps to look at this. Okay, what's the question?
No question. I just dropped the handout in the chat.
Oh, good. Okay. So I'm going to go through this one just so when you're by yourself and you have the handouts and you want to kind of work through it, think about the things that are going on in your life that are causing you to feel depressed or even anxious. Then I want you to ask yourself, what do I believe about these situations? Do I believe that I'm in a no-win situation? Do I believe that nobody's going to help me? And if that's what I believe, then I ask, what are the consequences of those beliefs? Do I believe that is the consequence of that I am depressed? Is the consequence of that I'm now worrying more than I've ever worried before? If that is the case, then I want to dispute this. I want to make sure that, no, I got to find another way to believe this. I got to find another way to think about this, because what I'm doing now is only exacerbating exacerbating my worry. And the fear of that, the worst part of that is, as I worry, I get physically, it affects my physical well-being. So I want to definitely figure out a different way to look at it. I use scripture as a person who research faith-based interventions. I use scripture to do that. Someone else may have different self-help books or anything that can give you a different perspective. Feed yourself with that information. Operating and connecting with the senior source would definitely be a great way to gather information that would do that. And once you get that, then you use that as a way of thinking to create a new way to operate, a new belief, and that belief is going to drive how you present, and it's going to eliminate, and it's going to reduce any severe symptoms of depression. And always, 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 if that's really difficult, please get help. Please, please, please. The senior source is there for you. They have many resources, and you're never, ever alone in this. So reach out. Questions?
Okay, everyone, I did drop the handout in the chat. If you want to save that or print it, that's there for you. It's got a lot of great information that Kimberly covered in her presentation, but do feel free to add any questions or comments to the chat or the Q&A section. And while we're waiting, I'll ask a couple of questions, Kimberly. What type of depression affects caregivers? Of all the ones you covered, what is the most common one that you see in caregivers?
Caregivers typically present with major depressive disorder. And major depressive disorder can be an episode. It can occur because there is an episode of depression. There may be reoccurring depression, meaning you will go through an episode because something happened and then you feel depressed about that, and then you bounce back. You're resilient, you bounce back, and then something else happened maybe a year or two later, and then it'll reoccur. So people who tend to cope, and unfortunately that is a type of coping skill. Is not a healthy coping mechanism, but it is one. So those who cope with depression may continue to cope with that way throughout their lives. And so when the things get really, really hard, depression may be their go-to. So I see major depressive disorder quite often.
Yeah, that makes sense. And then when you were talking about intervention, how do you know if you're having activating event or something that would trigger depression?
Good question. Good question. Life is hard, and not everything that we experience is going to create gonna lead us to depression. There are some things that you're gonna feel like you can grab the bull by the horns and ride it out. There are some things you're just gonna know that it's you got this. And then there are gonna be some things that happen that will feel extremely overwhelming. Like, whoa, I've never been here before. I have absolutely no idea what to do with this. And now what? And when you don't feel that, again, that you have control over a situation, that can be considered an activating event. The reason why they can include post-traumatic stress in this is because, again, depression, the trauma will actually create those bouts of depression, because feeling like you cannot control something, as humans, we're just built like this. We're just designed to label and control. we want to label it so we can control it. Our brains just work like that. And when you're not able to do that, it will feel debilitating. So when those things happen, yeah, you will, that will be an activating event. And as I'm saying that, I just realized that when you have these moments when you cannot control it, that's the reason why Senior Source is available, because they probably have done the research. They probably have experienced it before. Somebody in their organization or somebody that has come to them have experienced it before. And connecting with them would give you a sense of control. So there we go.
Yep, thanks. Yeah, I'm thinking about people who, I'm sure there are some on this webinar who are caring for children as well as older adults. And I can only imagine how overwhelming that is. So this presentation has got to be so helpful. And again, everyone, please grab that document that's in the chat. Any last questions and comments? I wanted to let you know too, when we end the webinar today, there will be a brief survey that pops up on your screen. Please take a minute to complete that, because that helps us to bring you great programming like what you experienced today. Kimberly Knight, do you have any final words?
I was just going to say that, first of all, Kimberly Pearson, thank you so much for such an awesome presentation today. I really enjoyed it. I'm sure our audience really enjoyed it, and just how you linked fear to anxiety to control. I've never, or it could have been anxiety, fear, then control. I've never thought about the root of it being control. In that way. And so, and as you were talking about it, I was like, yeah, I can totally see that, because we feel like it's something outside of what we can handle or do, or so yeah, that definitely resonated with me. As Kimberly said, as a Senior Source, we are here I just, all the things that come across our desk every day, you know, as way of what caregivers are going through, or just seniors in our community as a whole. And so allow us to be that resource for you, to help you, to guide you through this, and to just help you regain a sense of control as you are in the caregiving process. You can easily reach us. You can go on our website at theseniorsource.org. You can also call us at 214-823-5700, or you can email the Caregiver Support Department directly at csp@theseniorsource.org. So thank you so much. We are definitely here for you, and we look forward to assisting you in any way that we can.
Thanks, everyone. Hope to see you next Thursday, same time, same place.
Thank you.
Bye.
Bye-bye.
Bye-bye.